I'm going to talk to you today about stress fractures. They're easy to diagnose, they're easy to treat, most of them are. The important thing about a stress fracture when you're taking care of that patient is why did they get the stress fracture? So today I'm just going to talk about why did they get the stress fracture and what do you need to do to correct it so that they don't get another stress fracture. The first thing you need to look at is training. Did they bump up their training too quickly? The rule of thumb is don't increase your mileage more than 10% per week. And this is going to really focus on my running patients. So if you're going up too quickly, you're probably going to get a stress fracture because your bone just can't handle that increased force. The second thing you need to look for is, are they taking in enough calories? Especially my collegiate athletes who aren't living at home, they're going to school, they're working out with their team. Sometimes you just don't have enough time to eat. So you need to calculate their basal metabolic rate based on their gender, their height, their weight, and their activity level. Also make sure that they're getting enough protein. Most collegiate athletes need about 100 grams of protein per day. The third thing you need to look at is what is their vitamin D level? What is their bone health? Check their vitamin D levels. They should be anywhere between 60 to 80 if you have a runner that has a stress fracture. On some of my older patients, I even bump it up to 100, which will just help to protect that bone. The fourth thing to look at is shoe wear. Did they change their shoes? Did they get into a shoe that maybe doesn't give them as much support as before? If that's a change in shoe wear occurred right around the time of the stress fracture, they need to look for new shoes. So look for the four things if a patient presents to you with a stress fracture to prevent it from happening again: caloric intake, increase in mileage, vitamin D levels, and shoe wear.